and welcome to Laundrex Talks, organized by Clean India Journal and powered by Rent a Towel, where subject matter experts, industry leaders, and customers come together to discuss the latest in the laundry sector. I'm Nigant Warrior, Assistant Editor of the Clean India Journal, and in this episode, we'll be talking about the need for the stringent management of healthcare linen for the prevention of hospital-acquired infections. How does an infectious organism spread from an infected patient to an uninfected one? In the hospital setting, could contaminated linen play a role? And if this is the case, what linen management SOPs should be followed to make sure that the spread doesn't happen? What is the attitude of hospital managements towards managing their own linen? And how exactly do they work with service providers to make sure that it is hygienically processed every time? And finally, what fabric and what laundry processes are ideal to make sure that the risk of infection transmission is minimized, if not completely eliminated? From the medical director of a hospital to a linen management service provider, from an infectious diseases specialist to a hospital's hospitality management, we will listen to the views of all stakeholders. Dr. Atre, we have all heard some horror stories about how used patient linen used to be washed by hospitals, or rather given out by hospitals to be washed. I want to ask you, how has that relationship evolved over the years? How has the attitude of hospitals towards managing their own linen changed in recent times?
Laundry is something which people have not really realized the potential for infection or the importance of really taking care of the linen which is being used by the patients. So there is an awareness which is now coming in, but typically you would find earlier a lot of the smaller nursing homes would actually have a dhobi who would come and take it, and then you would find it drying on the lines outside. I think we have come a long way from there.
Some people, including doctors, have said that the role of contaminated linen in transmitting infections has actually been blown out of proportion. Dr. Warrior, you're a practicing infectious disease specialist. I want to ask you, do you find a direct link between contaminated linen and hospital-acquired infections?
The link between transmission of infection and the actual patients being affected is sort of that whole spectrum is very evident to us, like when we practice both infection control and clinical medicine. So in this background, if you look at the role of hospital linen, the link between contaminated linen and hospital infections are in the realm of mostly either outbreaks, meaning a cluster, a group of people getting affected together in the same hospital at around the same time, or in terms of small case series. That means where a couple of patients over time had a particular infection which epidemiologically or time-wise they linked it to something growing from the linen.
For a long time, hospital linen management was considered unimportant because there was no scientific evidence that connected it directly to infection control. Is that still the case? And if not, what does the latest evidence, what does the latest research say about this matter?
Now, over the last decade or so, we have multiple clinical problems which have come up, which have been linked strongly to the hospital linen. So that's how the perspective of the importance of hospital linen changes. So we have two groups of organisms which have gained importance within the hospital, causing outbreaks or multiple patients being affected within the hospital, which has been effectively linked to the linen management. So one group has been the fungal infections predominantly of the rhizopus or mucor group, which sort of infected the skin and also the lungs. So we had pulmonary and cutaneous fungal infections being linked to hospital linen in vulnerable people. And we had infections which were caused due to spores, like Clostridium difficile or Bacillus cereus, which are spore-borne bacterial infection, which is again linked to the hospital linen.
The scientific research that you've cited is very convincing. Based on what you've just said, what standards for the collection and the processing of used patient linen would you recommend for hospitals?
dispersion is an important mode of transmission of these spores and fungal thing from the linen. Okay, so when you collect the linen and if you sort of just wave it around into the environment, there is a lot of dispersion of this. So this dispersion is a critical aspect which you have to focus in the workflow. So your staff has to be trained in handling when collecting linen to avoid dispersion into the environment. The second part is about segregation and transport. Okay, so when they carry this linen all around, it is supposed to be in a closed container, so that again, in terms of contaminating the rest of the environment, we avoid that because it is well segregated into a compact closed thing. The processing part is now mostly standardized. Last years, we have moved on to mostly automated system. We have washers which we can set the disinfection parameters. So the disinfection parameters for the hospital linen depends on two things. It depends on what kind of disinfectant you are using, which is good for, which doesn't harm the cloth, but is still destroys the microorganisms. And it also depends on achieving the right temperature. So if you have automated washer systems, laundry machines, they enable you to actually set systems. It enable you to set the temperature, set the time of exposure, and adjust the concentration of the disinfectant. All these assuring that when the linen comes out of it, it is indeed disinfected to the standard which you want it to be. So that's very, very important. When you go for a lot of manual thing, achieving these standards, these parameters on a sustained continuous thing becomes a bit challenging.
Arindam, you are directly responsible for supplying clean linen to patients, where apart from the infection control aspect, you also have to take the hospitality factor into account. How are you dealing with this double requirement where infection control and patient comfort have to go together?
When we give any linen to a patient, we should ensure that the linen is absolutely damp free, no smell is there. Like when we talk about fungal, that means there should be a fungal smell, which is not correct. Number two is the storage of this linen is very, very important. What we do in a hospital is basically we maintain a temperature of the room, which is very essential for keeping any fungus away from that area. If at all any fungus is appearing in any particular locations of the linen room, it has to be addressed immediately. Since we are looking at the hospitality part of the patients also, so when we are making a room absolutely new, decorative and all, the linen, when they are putting on the body, that also need to have a nice smell. So that also we have taken into consideration, but taking into the loop with the infection control team, which all chemicals we are using.
It is also your staff that has to ultimately collect used patient linen from operation theatres, wards, and other areas of the hospital. What SOPs are you getting your staff to follow to make sure that infection doesn't travel from area to area or from patient to patient?
We have identified a different color coding bags for the soil linen to carry. The people who are collecting the linen from the dirty utility of the hospital floors, that is separately collected. It is not mixed with any other linen trolleys because we have a earmark separate in soil linen trolley. And then when it goes to the car with the vendor's factory or the laundry, it is very clearly being told that whatever the chemical that we have prescribed has to be given.
You've listened to the perspectives of end users. It's now time to come to the service provider to actually make sure that their requirements are fulfilled. Narayanan, I want to ask you, why is it that segregation is the most important step in linen management when it comes to the healthcare setting?
So if this is not done, if the most important element in the process is segregation of the linen. If the linen is not segregated properly, you will go for a toss. So all the stained linens will have to be treated differently, and it has to be a different process. It cannot be turned around in 12 hours to 15 hours. So it has to be properly separated. So you need to have enough buffer linen in your operations to make sure that you don't suffer for the linen.
What happens in the hospitality industry today is the 4 L's, which are basically linen, laundry, logistics, and the labor, are broken categories. So we at Rent a Towel would want to take the opportunity, the challenges, and use the technology to fix the unorganized sector and bring in the equilibrium amongst the 4 critical elements in the housekeeping function. Rent a Towel is driven by technology, challenges, and opportunities.
We've heard a fair bit about the risks posed by contaminated linen. Clearly, it needs to be processed in a very, very specific way. Compared to other segments, what is unique about the way that hospital linen needs to be processed? Narayanan, can you share some light?
It's a very tricky process because it has to be processed separately. So there are barrier washers which needs to be utilized. Say where you have the infection control linen entering on one side and you don't touch it so that it comes on the other side. So there is no very little manual intervention in the process of washing, right? And also from the segregation process, it needs to be properly done, and you should also give proper personal protective devices to these linen sorters in the hospitals so that they don't get closer to these infected linen. So as Arindam said, the RFID is the only solution where you can have a space of 10 feet, 12 feet, where you have the readers that will read the linen, and then you use your the gloves and mask to protect yourself in terms of segregating the linen.
Narayanan, apart from the changes that you brought about in the processing of used healthcare linen, you've also introduced an entirely new fabric for this sector. Why was this necessary? Why was it essential? And why do you think it's going to become the fabric of choice for the healthcare sector?
The linen what you purchase in the hospital is of 100% cotton, but the traces of the virus sits on 100% cotton material for a longer duration. Right, number one. Number two, any fabric that gets washed needs to breathe for at least 8 to 10 hours. But this is not happening in the industry because of your, the restriction in the power stock. So always you have a shortage of linen. So you are always on the toes of the outsourced laundry provider to bring it back, the linen, in a very shortest time, But at the same time, you're also killing the life of the linen because the cotton fibers will breathe, which it starts to open up after the washing is done. So tencel is a fiber. What we have done is blend the tencel fibers into cotton, and which has got certain characteristics in it. So it has got a better moisture control elements in it. It has got antibacterial elements in it. It stays for a longer duration. The fabric is the composition is made so better that it is better than the 100% cotton material.
At most hospitals, the management of used patient linen is outsourced to a third-party service provider. Dr. Attare, from the management's point of view, I want to ask you, what is it that you're looking for in such a service provider? What would your mandate be to that person?
More of technology, less of physical handling, more of natural processes in that sense also, if I may say. So I put in a linen, it is fused, it is cleaned, it is dried, it is ironed, and then it comes to me with minimal handling, because every time somebody handles it, you're in a sense maybe contaminating it also.
While doctors and administrators are beginning to be concerned about the quality of linen that is being supplied to patients, patients themselves may be quite unaware of the risks posed by contaminated linen. What role does linen play in a patient's experience in the hospital? And how are you working with service providers to make sure that every time linen is supplied, it is always hygienic?
So no patient is going to come into your hospital if you have stain sheets. No patient is going to come to you unless he's sure that it is clean, and especially now with all this COVID scare that is going around. Hygiene it's basic hygiene, right? Giving clean linen, giving linen that has been appropriately treated, being sure that it is not going to be a carrier of infection for the next patient who uses it. It is basic hygiene for any hospital. And I'm sure that the hospitals are looking at it and they are willing to spend on it. The question is that, do I want to undertake this exercise in-house? Or like we do, if we have an outsourced service, we have a regular visit to the site. And most of the time, these are surprise visits to ensure that the quality that is being promised is actually being delivered.
Attare, I'm glad to hear you say that hospitals have finally started allocating this definite part of their budget to linen management. Dr. Warrior, I want you to have the last word. What connection could you draw between contaminated linen, healthcare associated and hospital associated infections, linen management, and the financial impact of these infections on hospitals themselves? what role, what impact do these infections and contaminated linen have on the bottom line of hospitals?
The impact of healthcare associated infections, unfortunately in India, we have not mastered the act of converting this into a business case in terms of how much impact the healthcare associated infections have, how much does healthcare infections cost, and how much does the hospital save if it prevents such and such healthcare associated infections. So until people are convinced, right now we are looking at the basic science part of it. We are talking clinical medicine, we are talking infection control as a part of science, saying that if the mode of transmission has been proved, so since this is an proved mode of transmission, you should indeed take steps to avoid or prevent this transmission from happening, because it has been shown around the world that the vulnerable patients in your facility do suffer because of these infections, couple of which are serious and can even cause loss of life. So that's where we are harping now. And the reason for harping just in the science part is because, as I told you, unfortunately we don't have a good methodology, at least now, where we are able to quantify what is the financial impact of hospital acquired infections and then sort of link it to how much you can spend on the prevention.